for young patients, before we advise a replacement surgery, there are much better options. If the patient comes in early to us, like if there is only a single compartment involvement and if the patient has a deformity, we can very well do an osteotomy. Yani what we do is we make an artificial fracture and we correct the alignment of the leg and fix it up. So what happens is, if the alignment is wrong, we correct it and the patient's original knee can last for another 8-10 years. Also, the other option is of doing a partial knee replacement, or what we call as a unicompartmental knee replacement. Here we can do is only replace that much part of the joint which is damaged instead of doing a total knee replacement. But for both these surgeries, the patient really needs to come early to us and needs to fulfill certain criteria which the examining doctor will see, assess, and then will be able to give the best guidance. Also, in some cases where there is just slight arthritis or there is only a focal cartilage loss, like in really young individuals, we can also do autologous chondrocyte implantation, where we can take cartilage cells of the patient, take it to the lab, grow the cartilage, and then put it inside the knee. Also, we can do other procedures where we can take again cartilage from non-weight bearing area of the knee and implant it into a cartilage defect so that the cartilage grows there and we can prevent further arthritis from progressing. So these are the various options for really young patients when there is a need for doing something for cartilage loss. There are some few experimental treatments also, which are like stem cells, PRP. Sometimes they do show good results, but not so great. Even literature hasn't been supportive of these treatments. But these are maybe, some things we may need or maybe become better with time, and maybe we can recommend for young patients. See, this is what I tell the patient has to decide, because it is the patient who is suffering from pain. If the pain is really hampering your way of life, it is not allowing you to do your routine activities which you want to do, and if you've tried all other things and it is still not helping you, maybe in some group of patients, even if you are young, you can undergo a knee replacement. Who are these kind of patients? Now, I had one patient who was just 46-year-old, quite obese. He was like around more than 100 kgs, and he was suffering from rheumatoid arthritis. Now, because of the rheumatoid arthritis, his knee was really bad and he couldn't even walk a few steps. We had tried all kinds of things before. He was taking anti-rheumatoid treatment, visiting his rheumatologist, maybe had taken some injections in the knee also, but still the pain was not relieved and he was fed up. And then after doing all the things, then when he came to me, I suggested it, you can go for a knee replacement. So again, he was also a little worried about 46, but I said it's okay now, even if you're 46, since if you understand what are the implications that you are doing a knee replacement at a younger age and what limitations you have post-op, I don't think there is a problem doing a knee replacement in younger patients. Also, because of the advances in the type of implants in the materials that have come in, I think we are in a better position to advise a knee replacement for young patients. Now, who are these young patients? Jaise maine bola, they are not like all young patients we'll advise a knee replacement, but ones who are having rheumatoid arthritis and whose knees are completely bad. Second, maybe sometimes if it's a post-traumatic arthritis and the knee has gone bad because of the initial trauma. And third, because of, again, for secondary either to some injury or secondary to some infection, if the cartilage is completely worn out, maybe we could advise for a knee replacement in a young patient. So आगे वीडियो देखने के पहले आप प्लीज़ बेल आइकन दबा के इस वीडियो को सब्सक्राइब करिए, ताकि और भी कुछ कंटेंट रहा तो आप इसके बारे में इन्फॉर्म रहेंगे. See, whenever we are doing a replacement surgery for a young patient, let it be even knee or let it be hip, the patient has to understand one thing is you will get good pain relief, you will almost get back to your normal activities, but you should avoid doing high contact or high impact sports activities which can even damage your new knees. Okay, so you're not to do running, you're not to do deep squats, you're not to do any sports activities which will load your knee a lot. So we want that this knee, artificial knee, at least lasts you 25 to 30 years, so that when you are at that age, if you need another surgery of revision, which you will invariably need, you will have good bones and still will be able to give you a better result. So earlier mindset was we should avoid doing a replacement at a younger age group because we were not sure of giving very good results with a revision knee also. But now with, as I said, better technology, better implants, we do advise patients who are young to undergo knee replacement. But at the same time, we tell them that you understand maybe in your lifetime you will need another second surgery of a revision knee replacement. And we are in a good situation now that even the revision implants are much better, and even revision surgery is giving quite good results. And that's why we do not hesitate to even recommend going for a knee replacement in younger age group patients. I would like to request all the subscribers to share the video, share the channel, and ask their friends also to subscribe to my channel. Thank you, and we'll try to keep this content as far as possible, okay, in simple words, in English, so that सबको समझ में आए एंड इन्फॉर्मेटिव. अगर आपके पास कुछ भी ऑर्थोपेडिक रिलेटेड क्वेश्चंस हो जो मैं आंसर कर सकूँ, आप प्लीज़ कमेंट्स में लिख दीजिए ताकि नेक्स्ट जो भी मैं वीडियोस बनाऊँ उसमें मैं वो कंटेंट के बारे में इंफॉर्मेशन दूँ.